using your smartphones just like the rest of the webosphere out there. So for those of you who haven't had a chance to look, and you can look in your seats as well, please note the instruction card on your chairs, and all you have to do is simply text the question with 25827 as the quote-unquote phone number. You'll receive a thank you for joining, and then you can put in your question. If time does not permit, since this is a live webcast and it only lasts about 30-40 minutes, please take advantage of this face-to-face opportunity. You will have both physicians. You will actually have 3 or 4 here. Dr. Bajwa is going to be typing the answers to questions that we don't get to. And so after the event, please stick around, have a glass of wine, have some food, grab the doctors by the shoulders and make sure that they answer your questions to your satisfaction. And enjoy the fact that you have them here if you do have questions. Thank you all, and I hope you enjoy the program.
Hello, and welcome to UT Health House Calls, presented by the Mercedes-Benz dealers of Greater Houston. My name is Jerry Foyt, and I'm the GM here at Mercedes-Benz of Clear Lake. Thank you for joining us tonight for the 7th and final House Calls of 2018. We are proud to partner with UT Health as we bring awareness to important health issues and the incredible work that's being done by healthcare educators, providers, and researchers at the university. Thanks to this partnership, I'm also very proud to announce that Mercedes-Benz of Clear Lake has given $5,000 scholarships to 2 students of UT Health School of Dentistry, Lucia Karam and Michael Andrews, who are here with us tonight. Congratulations. Now, as you know, here to introduce our presenters is Karen Kaplan, medical journalist and longtime member of UT Health Community, who will also serve as moderator for the Q&A portion of tonight's event. Once again, thank you for joining us and enjoy tonight's presentation.
Thank you, Jerry, and thank you for welcoming us to Mercedes-Benz of Clear Lake. Tonight's program is on healthy aging and is presented by Drs. Carlos Moreno and Amber Zulfikar. Dr. Moreno is a professor and chair of the Department of Family and Community Medicine at McGovern Medical School at UT Health, and he holds the C. Frank Weber Chair in Family Medicine. He is a board-certified family physician and is actively involved in the teaching of medical students and family medicine residents while also maintaining a very active clinical practice. Dr. Zulfikar is assistant professor in the Department of Family and Community Medicine at McGovern Medical School. She is an active member of the American Academy of Family Physicians and the American Geriatric Society. She is also a board-certified family physician and certified in geriatric medicine. Both Drs. Moreno and Zulfikar see patients at UT Physicians Family Medicine Clinic that is located within the Texas Medical Center. So please join me in welcoming Dr. Carlos Moreno and Dr. Amber Zulfikar.
Good evening. Thank you very much, Karen, and thank you to Mercedes for having us here this evening. Thank all of you for being here and the greater world that's peeking in on us online or streaming. As you heard, Dr. Zulfikar is a geriatrician, so she'll take the really serious questions and answer them. I'm a family doc. I cover a broad range of things, but we both see patients. Actually, my oldest patient is 101, and I have many patients in their 80s and 90s. So there was a saying that I used to attribute to George Bernard Shaw, but when I decided to look it up and see whether he actually said this, I find that he didn't, but I cannot attribute this to anyone. I didn't make this saying up. I heard it. Somebody said it was Shaw. and said the secret to longevity is to choose your grandparents wisely. Okay? Now, what's that mean? If you think about it, genes have a lot to do with it, with your makeup, what conditions you might inherit, but the environment has a lot to do with it. There are areas in the world that are known as blue zones. You may have heard of this term. A fellow was doing some research trying to find out where people live the longest in the world. So where is that? Okinawa, Japan. Sardinia, in certain communities of Sardinia in Italy. In Nicoya Peninsula in Costa Rica. Where's the other one? I'm blocking on the, in Turkey, they're in Greece, Ikira, Greece. And one place in the United States, and that's Loma Linda, California. Okay? The rest of it are sunk. So if you live there, you'll have. So what's common? What's common to all these places? Strong family ties. Moderate activity all of the time. They don't live in Houston where we drive. They walk everywhere. A plant-based diet. Plant-based diet, limited amount of meats. Strong social involvement, been involved in their communities throughout their entire life. So those are some commonalities. Some of those things we can replicate in our lives. Some things we can't. The hustle and bustle of living in a large urban area is not the same as living on a Greek Isle. But healthy aging starts, I claim, starts prenatally. Good prenatal nutrition makes a big difference in how long you live. Having good health habits as a young child are very important. In adulthood, a set of other things kick in. When I talk to my patients about what they need to do in their 20s, 30s, 40s, it's very simple. You wear your seatbelt. Right? Makes a big difference. Don't drink and drive. Don't get in the cars driving if the driver's been drinking. Avoid dangerous places. Have safe sex practices. If you have high blood pressure, get it controlled. If you have diabetes, get it controlled. Eat in moderation. Lose weight. Exercise frequently. There's no magic. Those sort of things will help most of us live a long life. Now, there's intervening things that come in and get us sometimes that prevent us from living longer. But so we're going to cover a variety of topics. We're going to talk a bit about vaccines. There's some questions. There's questions about supplements. There's questions about very specific things that folks have submitted about hip and knee replacements and when to do that and why if you break your hip, why that's a problem. But I'm going to pass the mic to Dr. Zulfikar. Let her pick up here with her, and we'll be doing this tag team approach here.
Thank you. So I would start by thanking Mercedes-Benz to allow me to talk about my favorite group of people. Of course, I'm biased because I was raised by my grandmother. So looking at, because we are primary care physicians, we believe that prevention is better than cure. And there are small things which we can do in our day-to-day life to ensure that we have healthy aging or healthy living. So when we talk about prevention, the most important one is where you try to prevent a disease or injury from happening in the first place, which we call as primary prevention. And the most important thing which we can do is diet, because we are what we eat. So diet is supposed to be the most significant risk factors for premature death or disability. So when we are eating, we have to be very aware of not only we decide whether proteins, carbs, or fats are good for us. It's also important to know which fats are good. Not all the fats are bad for us. So it has to be a very smart choice that we make. So based on what we recommend usually is that when you have your plate, half of the plate should have fruits and vegetables. And when I say fruits and vegetables, potato is not a vegetable. It's treated as a whole grain in our body. So whenever you choose the vegetables, make sure you have different colored vegetables on it, which is aesthetically looks good to the eye as well. They are also very high in fiber content, so that's another source. And then 1/4, so we talked about half, then 1/4 should be comprising of whole grains. So whole grains, if you look at it, the less processed whatever you are eating is better for you. So if you look at brown rice versus white bread, pick brown rice, okay? And then, of course, 1/4 should be comprising of proteins. And mostly, like Dr. Moreno mentioned, plant-based proteins are better than animal-based proteins. If we look at it, like for instance, legumes, beans are not only just a good source of vegetable, it's a vegetable, at the same time, it's a very good source of protein also. Then we should also have certain dairy in our diet. If people who are like lactose intolerant, like 70% of people do have lactose intolerance, so we can pick stuff like greens have a lot of calcium in them, or legumes and nuts, we can pick that as calcium source. And then the primary beverage for consumption should be water, extremely important. And then a handful of nuts, peanuts, walnuts, they have polyunsaturated fatty acid and monounsaturated fatty acids in them, which are good for us. So there's this site which I usually recommend my patients going to and checking out. It's called myplate.gov. It has a very good visual kind of an application where you can click on different parts and they'll give you examples of what is good for you, based, the fruits and which whole grains to pick. So we talked about diet, which is the one thing which we can do. Second thing is physical activity. So when we are looking at physical activity, our main focus is always on weight loss, which diet is good for weight loss, which is important, but it's also important to pick a diet which has health benefits. So there are a bunch of diets out there which have proven, like evidence has proven that they prevent primary and secondary diseases. So there have been diets like Mediterranean diet or DASH diet, which we recommend in our patients because they will prevent you from getting cardiovascular disease, diabetes, obesity, certain form of cancer. They can decrease cognitive decline. So if you look at Mediterranean diet, it's not a hummus diet. So it's mostly what we just talked about. So all those food elements or groups which I just mentioned are part of Mediterranean diet. And then there's a certain, it's a 9-point diet where you score different points and it overall has a very good health benefit. DASH diet is another one which we use in our practice, especially in people who have high blood pressure. And what it stands for is it's dietary approaches for stopping high blood pressure. And an additional thing which is there is that it recommends minimizing the amount of sodium in your diet. So it should be less than 24 milligrams of sodium, okay? So that is what we were talking about. So next, physical activity, when we talked about that, usually we talk about aerobic exercises, which are good for cardiovascular diseases and stuff, which is moderate intensity exercise. I'll give you an example. If you're walking, it's a light intensity. If you are brisk walking or power walking, that's a moderate intensity. If you start to jog or run, it's a high intensity exercise. So it's recommended that throughout the week, distribute at least get about 150 minutes of moderate intensity exercise in a week. And then for my elderly patients or my GERD patients, also recommend certain forms of exercise to improve their balance, because one of the things which we want to prevent is falls. So the balance exercise, like for instance, Tai Chi is very good. Some people, because of the arthritis or because of weight, are not able to do the regular exercises, so we recommend doing aerobic exercises. Anything which is done like weight resistance or against gravity will help you maintain your balance. So when you are working out in the water, water also gives the resistance which you require to kind of strengthen your muscles. And then of course stretching exercises like yoga is good for your joints. So these are some of the ones which we recommend you do apart from the cardio exercises. Moving on, again, if we look at the common causes of mortality in elderly, the top couple of them are, like we talk, cardiovascular and infection. So while we are talking about primary prevention, vaccination is extremely important. So there are 4 vaccinations which you have to get. So the first one is flu vaccine, which is seasonal. It starts anywhere at end of September and we continue to give it till March. So a season, yearly flu vaccine. Once we turn 65, we need to get 2 pneumonia vaccines. So one is what we call PCV13 and the other one is PPSV23. So you get the PCV13 and then a year later you get the 23rd one. So those are the 2 for pneumonia. Third vaccine is the vaccine against shingles. Shingle is a disease which is extremely painful after somebody gets it. They can even have pain long after the rash has resolved. So just recently, I think a couple of 1 or 2 years back, now we have a new vaccine which is called Shingrix. And it has a 2-dose series where, again, we recommend getting it early on, like around 50, because the earlier you take it, the better immunity you get. So you'll get 1, and then within a month or 6 months, you can get the 2nd dose. And then the 4th vaccine is what we call the tetanus, TD vaccine. Tetanus is a life-threatening disease. Yes, it's not very common, but if a vaccine is out there to protect you, you just take it every 10 years. One of the doses has to be replaced by what we call Tdap, which has AP, which is actually supposed to give you immunity or protection against whooping cough, because we are seeing more whooping cough cases in our elderly. Of course, grandparents have grandkids, so it's also recommended for them to get it to protect them and the babies as well. So those are the 4 vaccines which are extremely important for primary prevention. Then, of course, making sure we don't smoke. Not only that we don't smoke, also try not to be friends with people who smoke. Like passive smoking is also not good for you. And then drinking alcohol in moderation. And when we say moderation, they're the whole bunch of like 12 ounces of beer and 3 ounces of wine and 1.5 of vodka. So there's a whole, so it doesn't mean that if you're allowed to drink 1 drink, you can drink any drink. Every drink, is different. The amount would be different. So for women, usually 1 drink a day. For guys too, but don't take my word for it. I mean, the lesser it is, the better. And then, so these are what we say what the primary prevention is. Moving on to secondary prevention. So when we talk about that is the aim, that's where our screening comes in. When you go to your physician, there are certain screening tests which they do. And the purpose of that screening is to detect a risk factor or a disease early on, so you're able to make interventions to protect you from getting all the complication or implication of the diseases, okay? So for instance, when you go in, there are certain infections you'll be checked for, like HIV, and then we recommend getting a hepatitis C antibody done, which is for hepatitis C in people who were born between 1945 and 1965. 1 time you have to do that. And metabolic screening would be any risk factors, because like I said, mentioned earlier, that the #1 cause of mortality is cardiovascular disease. So risk factors which could lead to cardiovascular disease, like high blood pressure, diabetes, high cholesterol. So high blood pressure is screened every single time you visit your physician. As for cholesterol and diabetes, usually it's done with a very simple blood test. So those are the metabolic screening which we usually do. Then of course, cancer screening. So cancer screening, there are some of the cancers which actually the most important risk factor is advanced age. So we start to, there are about 4 or 5 cancers right now which we screen for. In women, good news is that we stop screening for cervical cancer at 65 if you've had previous pap smears which have been negative, or for any reason you had a hysterectomy, which was because of a benign condition, for an example, fibroids, for instance. So at 65, you'll stop. You don't have to do further. Colonoscopy, which starts at 50, but again, it's based on your risks as well. So if somebody has family history with multiple family members having colon cancer, their age for getting colon cancer screening would be earlier. But if you just look at age specific, we start at 50. And then we have, breast cancer screening. Again, it's recommended, the guidelines differ, but 50 in some people and 40 in some, again, based on your risk factors. And either annually or biannually, depending on the discussion you have with your physician, again, based on your risk factors. And then prostate cancer, I don't want to mention it because it's like, do it, don't do it. But again, it's about the risk factor again. If you have a family member with prostate cancer, or you are a certain ethnicity, for instance, African American tend to have prostate cancer more, so they have to be screened with a blood test, which is a PSA. And then like I mentioned earlier, smoking, if you smoke, you earn yourself 2 extra screening. Lung cancer screening, and for men, it's what we call abdominal aortic aneurysm screening, okay? So people who have been smoking like 30-pack history, we start screening them at 55. And then we do one-time screening for AAA at age 65, okay? In women, very important to do a bone scan after the age of 65, because that determines your risk of getting hip fracture and vertebral fracture. So age-specific wise, it starts at 65, but again, if you have certain other risk factors, like let's say if you've been taking steroids, or you took steroids at any point in your life for 3 months, even as low dose as 5 milligrams, for instance, or you have rheumatoid arthritis, or you have low thyroid for which you are taking levothyroxine or medication like that, then you tend to be screened earlier. But age-specific wise, at 65, we start screening for osteoporosis with a bone scan. And then, so those are the ones. In elderly, there's something called geriatric syndrome. So we tend to also make sure that whenever the patients come in, or any of your loved one, if you're taking care of somebody who's more than 65, or, you know, so in those patients, there are certain questions which we ask to risk stratify again, because it's very important for them to have an autonomy to be able to independently function on their own. So, for instance, fall, we always ask about falls, and then, so those are the things which are just related to that. And then the last thing which I want to emphasize on is that medications are very important for you whenever you go to your primary care physician. You have to take a list of your medication. You might have a bunch of specialists you're going to, but your team leader should be your primary care physician. So we are lucky at UT, all our specialists are interconnected through EMR. So we get to see each other's note, and then we come up with a comprehensive plan for our patient. Same thing if you're hospitalized, it's important that every time you're hospitalized, make sure you make a very close follow-up with your primary care physician, because a bunch of, you know, imaging might be done or medication changes have been done while you were in the hospital, and that has to be known to your PCP. And then the last one would be advance directive. So everybody should have an advance directive up ahead, and it's like assign somebody as your medical power of attorney who gets to make decision for you in case if you're not able to. So I'll wrap it up, just emphasizing that there are small things which we can do day to day, which will take us a long way. And that also includes a small act of kindness. So I hope this was helpful.
Absolutely. Thank you, Dr. Zulfikar, and thank you, Dr. Moreno. And now we're going to open it up for questions. We've got several here. The first question is in regard to how one can mitigate their loss of memory or their feared loss of memory, particularly if various dementias are in the family. So what can people do?
Okay, so when we are talking about dementia can be of different kinds, of different types. So mainly Alzheimer's dementia, vascular dementia, Lewy body dementia, frontotemporal dementia, there's all different kinds. So most of the time it's because of certain proteins which are, because of genetic reasons. Those proteins can cause neurogenerative or damage to your neurons, and then it can appear depending on what part of your brain is affected of what the dementia would be. So if you look at Alzheimer's dementia, the main risk factor is family history and age. So unfortunately, we don't have anything which we can do to protect us from it. But there are other, like for instance, vascular dementia, in which mostly we need to take care of the risk factors. Like that dementia happens with mini strokes. So like high blood pressure, high cholesterol, diabetes, we need to make sure all of these risk factors are controlled very well. Also, like if you don't use it, you'll lose it. So trying to do mental exercises, meaning that, for instance, just one of my patients just recently told me, she's 93, that she's learning a new language. So that kind of makes you, or stuff like, volunteering somewhere, or learning a new recipe. So those are the small things which you can do to kind of, keep your mind exercising.
My mother, who lived to be 105, used to do word puzzles and just searching for words and so on. And she was doing that till about she was 101. But anything, and there's all sorts of computer apps that you can do now that help with memory, that help you get new skills. Try to remember phone numbers instead of writing them down. Make a short list for the grocery store. You can write it, put it in your pocket, but then try to remember. Anything that you actively use for memory is also very positive.
So basically, if we get rid of our cell phones and quit putting our phone numbers in it, we might be preserving. Well, and this is a follow-up question. What's the rule for those of us who are, close to 65, but who's asking here, regarding knowing what normal memory loss is? I misplaced my car keys again for the 5th time today, and some kind of pathology that is starting to set in. How do we know what's normal in a 21st century multitasking society versus we really need to get in and be screened?
So if we look at the normal aging, what it does to our memory is that it's definitely more difficult to learn new things. It takes a longer time to learn new tasks, but you will never forget the tasks which you've been doing all your life. So for instance, if you walk in a room and you're like, oh my gosh, why was I here? It happens to all of us. And then after a couple of minutes, you kind of, it comes back to you, as opposed to forgetting, what date it is or year, and continuously doing that, or anything which impacts your day-to-day living. So for instance, if you forget, let's say, one appointment, sometime, but on the other hand, if you're forgetting to take care of your bills month after month, that's another one. The way I kind of assess is that if somebody comes in and say, hey doc, I'm having issues with my memory, I'm already a little okay with that, and I say, hey, you have CRS, which is even more dangerous than Alzheimer's, and they go, it means that you cannot remember stuff, which is okay, everybody has that moment. But if it starts to affect, and then if a family member brings a patient and they say, and they complain that, we've been noticing this is what's going on, that is something which we are more concerned about, that, and you will be able to, like, if you are able to go back and tell us that, hey, I'm having memory issues, or I forgot this at a certain time or a certain incidence, that actually is something which is more positive. You still remember that incident.
You can recall it.
Right.
Yes.
The other thing along that line that may be a bit more advanced, but it's a signal, and if there's a family member there, it's people getting lost. You're driving along, and if you miss your exit, you have no idea how to get back. I mean, that's one. Forgetting how to get to your grocery store that you've gone for years. Usually a family member, but I ask people, do you get lost? Have you gotten lost? And people go, yeah, I was driving on the Southwest Freeway, and next thing I know, it's in Sugar Land, and I don't live anywhere near Sugar Land. And I had to call somebody to get me back home. I mean, those are pretty dramatic.
Oh, but that's a good point. The next question is, I'm in my late 80s and I'm terrified of getting pneumonia. I've never had it, but I've lost so many friends that way. I have also had all the vaccines. Why is it so much worse in older patients?
So again, there is something what we try to emphasize on. There's something physiology of aging. So certain things happen in our body as we get older. One of them is the waning of our immune system. It doesn't work as well as it does when we are younger. Also, another reason is that as we age, we get more chronic conditions. So you're already in a vulnerable state, and then further the conditions also kind of add to it. And then, of course, getting exposed to different pathogens around. So one of the reasons is that, because of the age and waning, you are more risk of developing pneumonia. And then the way and then certain conditions can do it too. So for instance, if somebody had stroke, so now they are more prone to get aspiration. Or if you're a smoker and now you are kind of crossed a certain, now the impact of smoking along with the changes related to aging would make you more at risk of getting pneumonia. So as long as you are covered, and one of the vaccine actually was added to the regimen. Previously, we just used to give one vaccine, but the newer one actually has shown that it gives us more protection. So that's why we give 2 vaccines now.
Excellent. This one involves a different part of the body. I'm 85 and female and just have started to have serious dental issues, both with my gums and with my tooth roots. Sounds like the teeth are starting to shift. How do I preserve my teeth?
Well, the dentist would probably say brush multiple times a day and floss, which does make a lot of sense. There's certain medical conditions that I think predispose people. If you have diabetes and don't take care of your diabetes, you can really get terrible gum disease and end up losing your teeth.
The question goes on to talk about also a fear of Fosamax. In other words,
Okay.
she is not, it looks like she is not taking an aggressive calcium supplement out of a fear of Fosamax and all the bad press that it's gotten, but must seem to have some osteoporosis as a problem.
So meaning that they don't want to take Fosamax because of the dental fear?
A fear of taking an aggressive treatment such as Fosamax because of, the deleterious effects that it can have. And so it looks to me like this questioner is stating that the bone loss from her teeth is causing a problem.
Okay, so one of the things which we have seen is a very rare side effect of Fosamax, which is osteonecrosis of jaw, which is extremely like a very serious disease. But there has been mostly seen in people who have been on Fosamax for cancer meds. So it's a rare disease. So the way we do it is that if we are putting somebody on Fosamax, we make sure that we make a kind of a joint decision with their dentist and let them know that, talk to your dentist, let them know this is one of the medication you'll be put on. Is there any reason for you not to be on it? As far as the side effects of Fosamax go, yes, like any other medication, like Tylenol also has side effects, so you have to weigh the risks and the benefits. So if we look at it, if on the other spectrum, what would bone loss do? It would cause you to have hip fracture, for instance, and hip fracture increases mortality. People die from after their chances of dying after hip fracture sometimes doubles, right? So yes, there are risk factors, but then again, like I said, it has to be weighed, the risks and the benefits, and it definitely does protect people from getting both vertebral and hip fractures. So
Okay.
I hope that answers
Yes,
the
I think
question.
so. Thank you. This one is, my children are always on me to drink more water. I'm not thirsty, and frankly, water is boring. And then I have to go to the bathroom all night. What is it with this generation and water? Are they right? How much water am I supposed to drink?
You know, the eight glasses a day myth has been out there for years. There's no good evidence that 8 glasses of water a day. You need to drink liquid. The easiest and least expensive liquid to drink is water. You can start paying good money to get flavored water. You can, if you do that, invest in the company because they're just making money off people. And then if you're drinking sugared drinks, but you got to drink liquid. So the easiest thing I tell people is when you pee, if it's dark, you're probably not drinking enough water. If it's concentrated, if it's light, yellow, you're probably drinking enough water. That's probably the easiest gauge there is. And so I can tell you, you know, you got to drink 7 and you got to drink 9 and glasses of water. You have to drink water. The body is made from water. We all came from the sea at some point, and so you can't avoid it. You can't avoid it.
No, it's great
So,
advice.
but I would like to add that when, with aging again, that thirst, the feeling of thirst, it goes down. So there are many times when you would not, when do we drink water? When we are thirsty. So, but as we age, that mechanism doesn't work as effectively. So you have to consciously make sure that you keep yourself hydrated. Because again, in a state of, especially people who are very frail, they are in a state of hemostenosis where they are more at risk of developing dehydration.
Diseases that I have finally outlived and just won't get.
You won't get pregnant after 60. So there are a lot of diseases again where the risk factor is age, right? So high blood pressure, diabetes, heart attack, stroke, a lot of them actually are, you're more prone of getting when you age. So it's a fairly challenging question, very good question. I'll look it up and see if I can find something which is, you know, all I could.
But you'd be surprised because I've had 92-year-olds get gallbladder disease and need to be operated. I've had 94-year-olds that have had an artificial valve replacement because it finally gets. So a lot of these things are added. There probably are multiple things that you might not get as one age, but you're still at risk for a lot of things.
Gotcha.
The schizophrenia, I think, is a bimodal one. So that's another one, and that's a very good point because sometimes people with Parkinson's or people with Lewy body dementia can present with hallucinations, and they are misdiagnosed that, oh, you have schizophrenia. So at that age, and never say never in medicine, but highly unlikely. So yeah, I think that's one I could think of.
I would be willing to say polio, but I'm afraid that a resurgence will pop up. So.
Bad against any infectious disease.
Is atrial fibrillation a natural consequence of aging? Both my parents now have it. They're in their late 80s, and every time I turn around, someone is telling me that they are diagnosed with AFib.
Well, it's a consequence of aging in that it's related to arteriosclerotic cardiovascular disease. So if you have decreased blood flow to certain parts of your heart, of the atria, and the normal generator of electrical signal in the heart isn't working, and you get a secondary one, and then the atrium, the upper level of the heart, starts quivering, and then your heart can beat irregularly. Does the fact that your parents both had it mean that you're going to get it? Maybe, but if both of your parents had high blood pressure and didn't treat it, they had cholesterol and didn't treat it, never exercised, smoked, all the factors end up changing. So it isn't a yes, you're going to get that if your parents had it.
Okay. We have time for literally one more question. And I'm going to, there's so many I could choose from. I'm going to choose this one simply because it affects so many people from a fear standpoint. Why is a broken hip in older patients such an automatic death sentence?
Okay, so, and it's a very interesting question because there is data, there is evidence that if you have hip fracture, your mortality risk goes up. Why does it happen? One of the things which I was researching is that most of the time, either it could be cardiovascular disease, which is there, one of the reasons, or infection like pneumonia. But as an expert opinion, I would say no evidence basis, because again, like going back to the basics, when somebody has hip fracture, they are not as physically active as they can be. So they become more like, it's a condition where you become deconditioned. You spend more time in bed. So again, aspiration or, maybe part of it could be depression as well, because, you are not able to do what you were easily able to do before. So your independence factor is kind of taken away from you as well. And so those are some of the things, but there's no evidence that I could find where it says that what exactly causes it, but those are a few reasons which we have seen that they have caused.
In the old days, we back up 30 years or so, people had a hip fracture, they'd lay in bed. They wouldn't move. The observation was made that those people get blood clots in their legs, get a pulmonary embolus, get pneumonia because they aspirate, they can't move. So that's why physicians are very aggressive. You get a hip fracture in an elder, they at least want to pin it, and if they can safely do it, they'll replace the hip because they'll get you out of bed and moving, and that moving helps prevent that mortality.
I have to ask one more question, I'm sorry, because it's come up several times, about knee replacements. The tippy top of the age, assuming you're in reasonably good health, how old can you be to get one, and what can you do to not have to need one?
Gray is the new blonde.
Pardon me?
Gray is the new blonde, so there's no such thing as being very old. It's like how functional you are. And then again, for any surgery, for any kind of treatment, aggressive treatment, we tend to do what we call a comprehensive assessment. And if somebody who are functional, who all their comorbid conditions are very well controlled, absolutely it's something which we encourage to do, because going back to where, the previous discussion we were having is that whatever keeps you active, whatever keeps you out of bed, whatever keeps you moving, that's important.
There's also partial knee replacement now instead of total knee. The whole approach has changed now, that certainly people well in their 80s are still getting, patients of mine, 85, 87 are still getting, and these are very active people.
Right.
I mean, they don't want to slow down.
So more like, sorry, Karen, just wanted to add a quick point is it's very patient-oriented thing. So when we are taking care of our elderly, it's not a cookie cutter kind of a picture. It varies from person to person. So if somebody already has dementia or they have multiple comorbidities, yes, their surgery would be an additional risk factor. As opposed to somebody who's highly functional, it's a total different story. So keeping in mind that varies from person to person.
It is nice to know that the older you age, you can receive the even more personalized medicine, so thank you. Dr. Zulfikar and Dr. Moreno, thank you for reaffirming that aging is a natural occurrence that can be embraced with a healthy anticipation and great hope for great next chapters in our lives. I'd also like to thank Dr. Natasha Bajwa for her diligent responses to online questions that we didn't get a chance to address during our presentation, and certainly deep gratitude goes to our kind and generous hosts at Mercedes-Benz of Clear Lake, and ABC 13 for giving us this wonderful platform to inform and inspire the Houston community to lead healthier lives by providing us with greater knowledge and awareness through these events. I'd also like to extend our gratitude to, of course, UT physicians, our partners in health from McGovern Medical School at UT Health, who teach, train, and treat, and provide the highest quality care for our entire family. For more information, please feel free to go to utphysicians.com. Tonight was the 7th and final UT Health House Call for 2018. It has been an honor and a true pleasure to partner with such authentically giving organization as Mercedes-Benz Dealers of Greater Houston and the many dealerships in our area such as Mercedes-Benz of Clear Lake. To view tonight's program, please visit abc13.com. Thank you all, and I hope to see you at another UT Health event very soon. And for our in-house audience, please grab the docs. Talk to you later.